definitely think this is 100%, but I can tell you my reasoning. So what I just did with your arm is I did a neural tension sign test. First of all, I started with your neck, and I did all these compression tests, and I actually got a decent range of motion overall. So for you to say, like, yeah, maybe I can kind of move this way to swing the ball, fine. Like, I'm not even opposed to that. It's not like you're, like, stuck here.
Right.
You can do all this.
Yeah, I can move, yeah.
When I pressed on your neck and compressed it and did all these funky things to it, normally that sometimes closes down the spaces and causes some nerve pinching. Through here, we did not see a lot of that happen to you down through here. But you did have some pinpoint tenderness around the C6 area, which kind of correlates with this hand.
Yeah.
So here's like the C6 dermatome is like this. C7 is like this. C8 is this. So here's C8, here's C7, here's C6, and then we have like C5, a little bit of C6, T1 through here. Basically, is what I'm saying.
Okay.
Pretty much that areas that I just said correlates with a single spinal nerve. Now, there's no such thing as a single spinal nerve because it's the way it's built is an overlap system.
Right.
I'll talk about that in a second. But generally speaking, you kind of have a good idea. And that's why I was able to tell you what you're probably going to be feeling before you did it. Is because I was like, hey, is it this? You're probably going to feel this. You're probably going to feel this. You're probably going to feel this. Want to let you know this is why.
Right.
And now because I'm trying to pull down on these nerves. So I tested your neck for that to see if it was truly pinched at the neck. I wasn't 100% convinced on that one, you know, because you didn't trigger any symptoms.
No.
What I do like, though, is that it didn't trigger symptoms, so that it's like, okay, well, we probably could have a lot more range in your neck.
Right.
In your case, what I did is I pulled down on those nerves, and I did those nerve tension signs, and I kind of pulled down on that radial nerve.
Yes.
Going this way, and I pulled a little bit on the median nerve, and it created a little bit of irritation. So we know, congratulations, that tells me we have a little irritation of one nerve more than another, the radial nerve. The radial nerve is the one that does this.
Yeah.
Okay, so if we kind of follow it down a little bit, we'll kind of come across right here, radial nerve. Then we have a deep branch and all that other stuff, and the superficial branch that comes across. So that's why a lot of people will feel pain across the top of that area here, and then they'll also have some of that nerve that goes all the way down and into the hands and fingers, if that makes sense.
Yeah.
So right there, that's the radial nerve. And then what I tested you for is a couple other things after. That's what I had you deep breath in, hands over your head. When we put our hands over our head, typically in a cervical radiculopathy, meaning a neck irritation issue, where if we put our hand over our head like this, we put a lot of slack in these brachial cords out here, and actually they tend to relax a lot, right? So if those get a chance to relax a lot, usually the pain goes down. But in this case, the pain went up. So then we start asking other questions. That's why I followed it up with other tests. I said, wait, so that increases. So what that does, though, it creates slack here, but it closes off the space in this little triangle there. Okay. So then what I did is I took your arm and I kind of shoved down. How do you take these deep breaths and do stuff like this and like this? And what that does, it puts a lot of cervical stress on these cords in this direction, in this triangle. And then usually you can indicate that, you know, is this thoracic outlet syndrome? Thoracic outlet is essentially a closing down of this little, I'm going to say this triangle there.
Yeah.
More specifically, if you really want to be very anatomically specific, it's this triangle at the clavicle, the ribs. That's why I believe you felt a lot of irritation, like right through here.
Yeah, because even like those flutters are like on, this is what, the first rib and second rib, it's up in there.
Yeah, so you're actually, this is actually the third rib there.
Oh, okay.
Because like we take the clavicle, look, rib 1, rib 2.
Oh, got it. Okay.
So yeah, it actually almost looks like it's a second here, right? Because it's blocked. Right.
Got it.
So but that's where a lot of that. And when I had you go right and left, it was to see if the posterior scalene, which is back here, as it drives forward, it should push into the nerve, or is the front of the anterior scalene on this side, as we go this way, does that put into the nerve?
Yeah.
So we kind of asked those questions. Is it forward or backwards. We don't know. Both of them came positive.
Mm-hmm.
So I don't think I have a direct answer of like which scalene muscle it was.
Yeah.
But I do think that you are having, by definition, more of a, if I had to say, is it more neck issue or is it more cervical irritation as a result of thoracic outlet syndrome? I'd say it's more that one.
Okay.
So thoracic outlet syndrome is a fancy way of saying like you have either, is it coming from a tight pec muscle? Sometimes the pec muscles. So if we look at the pec muscles, we draw them from here. So there's third. That's the pec minor. So sometimes those can cause a lot of issues.
And they're all attached right there.
Yeah, and so they all have to drive right through there. Wish we could make another cover.
Yeah, because last week I was having and I asked my massage lady, it was crazy because that you said that, but I was like, when I touch this, and push down, I feel the tenderness. Not now, but last week I felt it. Rest has taken that pain away, but it was up in here.
When you do this, we also do it does close off this area, but I didn't also mention, I forgot to mention this, that when we do this is a pec stretch. So when we're doing this, we're taking that stretch of that pec across the nerves that are already irritated across the cord. So this is a pec stretch.
Yeah, my motion on this side is shit.
So in that case, if I had to again, I broke it down, and I'm breaking it down again, now I'm breaking it again. If I had to really, really, really say exactly what was happening, I think you're having thoracic outlet syndrome as a result of overdevelopment of this anterior chain here.
Mm-hmm.
More specifically, probably a little bit of pec minor, pec major irritation.
Right.
And then that could affect the medial pectoral nerve, which if we that's a branch off the C5 nerve route. So right there, or that's a lateral, but you also have a medial one coming down this direction over here. So it's one's lateral, one's more medial. So this is the lateral pectoral nerve, which can kind of flutter this whole area because they do innervate some of those. It does innervate some of the chest muscles.
You mind if I show you something? You mind if I grab that?
Go for it. Yeah. Go for it. That's what we're here for. That's why it's here.
So I'll show you my motion so that it kind of adds in together. If I was over the ball and I was coming up, I'll be mindful of this painting right
That's
here.
All right.
But if I was over the ball and I was coming up, my motion is to come up here this way.
Yep.
Right? And then I've been working with a coach on this is that, I kind of, rotate in this way and then come through across.
So that's more like a baseball swing.
Yeah, it'd be on the ground there. But then as I finish, it's this way. You know what I mean? So that's my whole motion, the whole time. So that what you're explaining kind of makes sense. Because it's almost like a pulling down motion that I feel coming in here even right now.
And that's why when I kind of just pulled straight down on your arm, I just went like that, you're like, dude, I feel that.
Yeah, I can feel it. Even right now.
So that's why I think, I'm not saying that what came first. Was it the rug? Was it maybe the rug's caused a little bit of irritation from your neck or your posture, and then maybe just being physically active? I would probably even say this is probably more of a sports related injury than it is actual a carpet and flooring injury.
Yeah.
I think that might have started it, and
this chain of events.
As you know, with social work, it's never just like, hey, this person just lashed out. It's a chain of events that made them lash out. Right? So I think in this case, if we work a little bit of the nerve route, more specifically, if you said, what the heck are you going to do right now in 5 minutes or less, I would be working here and here.
Yeah.
I'm gonna do more than that, but
yeah.
I was testing your neck a little bit. You had pretty good range.
Yeah.
I think you had pretty good stuff. I do think there was some tenderness in there, but I don't really think that's the low hanging fruit.
Yeah, I did a shoulder workout yesterday too, so
I just don't think that's the low hanging fruit here.
What about in between the blades then? What do you think causes that portion of it then?
Well, that's usually an irritation of the dorsal scapular nerve, which can be it could be as a result of the protracted shoulders as a result of overdevelopment here, so that you're not in this way, and then that as a result of your posture coming forward. I do think we can work on that, but sometimes I see a lot of dorsal scapular nerve here. I always assume it's dorsal scapular nerve until I'm proven wrong, because I used to treat it as muscle pain, and I was proven wrong until it was dorsal scapular nerve. If that makes any sense, right? So I typically find that it's a branch off that nerve route there.
Yeah, because it exacerbates after sitting. You know what I mean? Even yesterday, or what's today, Wednesday, Monday at work after playing. I played Saturday, Monday. I sat down, and after that, it was just I sat down for an hour, and that was it. My back was just killing me. And now I think
that's not even that long.
Yeah, and like just it gets better when I lay down. You know what I mean? But like I got the little thing underneath my seat. I think my chair sucks overall, but I got the thing underneath my seat, and I try to like get here. But like you said, like when I'm like in this position, anywhere close, and not even like fully open this way, it's like.
I think what your goal should be eventually, like in terms of sports performance and rehab, is working some posterior chain stuff between the legs, and so that you can drive power while you're golfing. Punching, whatever, it's actually almost the same rotation, right?
Yeah.
To some extent.
Right.
And then we really need to focus on, like, if you're spending a lot of your time like this, and then you're spending a lot of your time like typing and then casework, I mean, we gotta open this up and do it in a way that's not triggering those symptoms going down to the arm.
Gotcha.
One nerve, the radial nerve, was definitely worse than the median nerve.
Right.
Otherwise, you'd feel it go all the way down to the hand.
Right.
But so I think